Competency 9, evaluate practice with individuals, families, groups, organizations, and communities. So this presentation is on the evaluation of client services and programs. Evaluation is usually evidence-based, and most practices are evidence-based, meaning there's research done and interventions and assessments are implemented based off of the things that work. In hospitals, there's always being data collected, and with that, it is used to provide improvement of services in patient care. Records and discussion of number of inpatient and outpatient services are provided, and there's always a kept ratio of uninsured and insured patients when a hospital is in need of making up for cost or providing certain services to certain community members. Patients vary among the elderly, low income, children and youth, pregnant women, burn survivors, undocumented, and furthermore. For each of these individuals, challenges in socioeconomic status, culture, background can be influential in their progress during and after discharge from the hospital. To assess client progress and evaluation of services, it can often be difficult with patients who come in with severe medical conditions or unexpected medical needs. But many research methods are evidence-based and therefore include surveys, questionnaires, case studies, and more. Oftentimes, surveys lack the support to provide sufficient and accurate evidence and data to reflect the progress of clients during their hospitalization and after. But research is often challenged with certain populations like the elderly and undocumented, and therefore always improving and always finding ways of addressing certain populations' needs. For the undocumented, for low-income patients and elderly, there's always the lack of primary care or routine health care. There's barriers in affordability and access to care, communication, advocacy, ethical and appropriate treatment. However, there are facilitators such as social workers, caseworkers, nurses, family, and caregivers who can provide the advocacy efforts on behalf of these clients to address their needs and appropriately engage with them to provide them with the services that best fit their needs. For undocumented, they face the lack of inability to access health care. For low-income patients, there are resources provided to them. However, there are other factors such as poverty or where they live or their family support, their social support, and other background influences that may be barriers to them accessing the adequate resources. For the elderly or older adult population, many are very competent and able to advocate for themselves. However, you may run into cases where children want to have the say-so, or elderly in homes or in assisted living or in nursing homes often don't get the special and needed treatment that's best for them to help them through their medical needs and through their processes of adulthood or later adulthood. And therefore, these facilitators are needed in all cases with all clients so that they are able to positively move forward through engagement and assessment